of guidelines and health protocols to reduce the spread of COVID-19. These guidelines are also supposed to impart knowledge and skills to prevent contracting and control transmission of COVID-19. Lastly, to guide on mechanisms of offering psychosocial support to learners and staffs affected by COVID-19. These are some of the guidelines that I'm talking about. We have the guidelines on health and safety protocols for reopening of basic education institutions amid COVID-19 pandemic. We have the Kenya Basic Education COVID-19 Emergency Response Plan. We have the executive orders from the National Emergency Response Committee on Coronavirus, as well as circular by Head of Public Service on workplace. So we need to utilize this so that we are able to stop the spread human-to-human transmission of COVID-19. So talking about COVID-19, what have you heard about COVID-19 so far and from what source? Because I've muted you as Mr. Simat has, because we have a large number of participants in this workshop, we will kindly request you to engage with us in the use of chat box. Let us share our experiences and let us share any challenge or any inquiry that you want to make through the chat box. And let us interact and share what have 19 so far and from what source. I'm giving you 1 minute, then we'll be sharing in your responses before we proceed. Kindly respond through the chat box. What have you heard about COVID-19 so far and from what sources? There's a response from new COVID-19 strain from the media. Thank you so much for the response. Highly infectious. COVID-19 is with us. A result of Chinese eating bats. Thank you for those who are responding. COVID-19 has no cure. It's a pandemic. The virus mutates. Thank you so much for your responses. Thank you for talking to us. At least we know we are together and you are hearing what we are saying. So we are going to quickly go through the slides. What is COVID-19? Okay. COVID-19 stands for coronavirus disease. It is a respiratory disease caused by a newly diagnosed coronavirus. When we talk of a respiratory disease, we are saying this is a disease that affects the respiratory system. We are talking about the respiratory system, the nose, the mouth, the pharynx, trachea, the airways, as well as the lungs. So all the disease affects the respiratory system. COVID-19 has reached the level of worldwide pandemic. It affects all aspects of daily life. It affects education, worship, travel, trade, tourism, food supply, and financial markets. If you have not been affected directly, at least you know one or any other person who has been affected, but we are all experiencing these effects of COVID-19. So where did the pandemic start? Some gave the correct answers, and we all know that it started in Wuhan, Hubei province, that is in China, in December 2019. And it's true, it started from a local food market that is known to sell live and freshly slaughtered hunted animals, such as bats, snakes, and pangolins. And this is a new virus that has not previously been identified in humans, and not much is known about it. That is why we still have a lot of studies and researches that are ongoing to help us understand more about the disease, as well as to chart ways on the preventions. And so the statistics. We see the CS Ministry of Education, Ministry of Health, giving us the statistics every day of the people who are affected, the number of cases, people who are tested, the number of deaths, those in hospitals. The statistics are true, yes, and we have these people who have been affected, some have died, and some have recovered. From what we are seeing here, as at May 1st, 2021, there have recorded cases of about 160,000 people who have been diagnosed to have the disease. The deaths at 2,700, case fatality at about 1.7%. So what we are saying is the disease is real and affects people in Kenya, but across the world. We have also seen the world status. That means it's affecting people across the globe. We are moving forward to talk about how COVID-19 is spread. I know we are getting information from all the sources that we talked about when we were beginning. Kindly respond through the chat box. Tell us, how is COVID-19 spread? Give your response. We are giving you 1 minute to respond as we proceed. It is spread through close contacts. Thank you, Emmanuel. Airborne, body contact, airborne disease, close contact, sneezing through the air, contaminated surfaces. Thank you for the responses. They are coming. Shaking hands, body fluids, air droplets. Thank you so much for participating. We are proceeding to look at how COVID-19 is spread. We are saying the virus is spread mainly from person to person. And this is when a person is in contact, that is within about 6 feet from each other for 15 minutes or more. So we are saying if there are people who stays in close contact within 6 feet for 15 minutes or more, the virus spreads from one person to another. Also, the virus spreads through respiratory droplets. These respiratory droplets that are produced when an infected person coughs, sneezes, shouts, or talks. So when you are in a close proximity to this person and they either talk, cough, sneeze, shouts, and this produces these droplets and you inhale them, you get infected. So these droplets can land in the mouth or nose of those people who are nearby, or possibly be inhaled into the lungs. So the best way to prevent illness is to avoid being exposed to this virus. Here we are saying virus spread mainly from person to person through respiratory droplets. The incubation period, we are saying this is the time between exposure to the virus and when the symptoms appear. The signs and symptoms of coronavirus disease may appear between 2 to 14 days after exposure. We have seen that it is spread through respiratory droplets. So if a person inhales the infected respiratory droplets, you may not be sick immediately, but there is this incubation period of between 2 to 14 days after exposure when you might experience the signs and symptoms of coronavirus disease 2019. But if a person remains well even after exposure, the person remains well 14 days after the exposure, it is unlikely that you are infected. So it is not that even anytime you get exposed, you must experience the signs and symptoms. You can get exposed and you miss to get infected. So after exposure to the infected droplets, within 2 to 14 days, if you are infected, you will develop the signs and symptoms. So talking about the signs and symptoms, what are these signs and symptoms of COVID-19 that we are talking about? Please chat your responses in the chat box as we proceed. Give us your responses through the chat box. What are the signs and symptoms of COVID-19? Good, the responses are coming. Fever, coughing, difficulty in breathing. Thank you so much for participating. Blocked airways, suffocation, persistent cough. Thank you so much all. This is an overwhelming response from you. A number of you are really participating. Talking about the common signs and symptoms that some of them we have said in our responses. We are talking of fever, cough, shortness of breath, fatigue, body aches, headache, loss of taste or smell, sore throat, runny nose, nausea, vomiting, diarrhea, even redness of the eye. So a person may experience one or more of these signs and symptoms combined, but what we are saying is that we have some infections we are living with that also exhibit with the same signs and symptoms as we are seeing here. Doesn't mean that a person who has a cough or a headache or even a sore throat, this person is having COVID-19. No. A person is said to be having COVID-19 when they test positive for the virus. So we are saying these signs and symptoms should guide you to seek treatment or to get tested so that you stop the transmission. But let us not say that anybody with these signs and symptoms have COVID-19. You must get tested to confirm that you have the virus for us to say that you are COVID-19 positive. There are also signs and symptoms of severe COVID-19 disease, and we are saying that since it mostly affects the respiratory system, the individual usually exhibit troubled breathing, persistent pain or pressure in the chest, confusion, inability to stay awake, as well as the lips or the face turning blue. And here we are saying this is an individual who is in danger and should seek immediate medical attention as soon as possible to prevent us from losing this person. We are teachers and we handle our learners at the institution. So we are asking, can children get COVID-19? We are saying yes, children of all ages can contract COVID-19 and also they are able to transmit it to others. We are saying that children do not become sick as often as adults. And even if they become sick, it is usually mild symptoms and sometimes no symptoms at all. And they recover within 1 to 2 weeks. Adults usually take 2 to 6 weeks. That is a little bit longer time, but children recover fast. Within 1 to 2 weeks, they have recovered and they experience mild symptoms. But we need to take into consideration the children with underlying medical conditions because they are at higher risk of get tested for COVID-19. Thank you for the responses. They are coming. All, thank you. All, everyone, anyone, everyone, thank you so much. We need to start with us before we point to other people, okay? You and me, we can get tested. So who gets tested? We are saying a person with the signs and symptoms of COVID-19. I previously said the signs and symptoms, and if a person is exhibiting any of those signs and symptoms, doesn't mean that you have COVID-19, but you need to take precautions so that in case it was COVID-19, you do not infect other people. So precautions, you need to get tested, know whether you're positive or whether you are negative. So people who get tested, those with signs and symptoms of COVID-19, those who had close contact within 6 feet for about 15 minutes or more with the person who is confirmed to have COVID-19, and those who have been asked or referred to get tested by their healthcare providers. We also have those who are traveling. It is mandatory right now that you get tested and you have a test result. So after getting tested, what do? We recommend you self-quarantine or isolate at home pending the test result. Yes, this person is having signs and symptoms. After getting tested, don't walk around because you never know. You may be positive or negative. And if you test positive, isolate yourself. Nowadays, we have home-based care. Take the measures to protect others, your immediate family members, and the other population from getting infected with COVID-19. But if you test negative, you probably were not infected at the time you were getting tested. So continue to take measures to protect yourself, because a negative COVID-19 test result does not mean that you cannot be infected later. If you do not take the necessary measures, you can test negative today. After sometimes, you still can test positive. Let's watch a short clip that is telling us about prevention measures.
Virus and other infections. This means staying home as much as possible. The PFF is closely monitoring COVID-19's impact on the pulmonary fibrosis community. While there are still many unknowns, we do know there are several everyday precautions you can take to help avoid infection. Currently, the best thing you can do is avoid exposure to the virus and other infections. This means staying home as much as possible, limiting contact with those outside your household, and avoiding non-essential errands, visits, and travel. When you do have to leave your home, practice social distancing by keeping at least 6 feet away from others. A face covering should be worn when in public, especially when social When you return home, wash your hands as soon as possible. We also recommend washing your hands at these key times. Regular cleaning and disinfecting of frequently touched objects and surfaces can help prevent coronavirus and other contagious illnesses. If you're wearing a reusable cloth face covering, be sure to wash it after each use. Disposable face coverings should not be reused.
Okay, that clip was talking about prevention measures, and that is what we are going to talk about next. How can the spread of COVID-19 be slowed down or be prevented? We have seen some in the clip that we have watched. So the responses in the chat box so that we know we are together. How can the spread of COVID-19 be slowed down or prevented? Observing the guidelines, wash your hands regularly, vaccination, put on masks, social distancing, using face masks. Thank you for the responses. So this is the summary of the prevention measures that we have talked about. Regularly and thoroughly clean your hands with soap and running water for at least 20 seconds. This is done regularly and you do it thoroughly all the time. Please use soap and running water. If soap and water are not readily available, use a hand sanitizer. That is a hand rub that contains at least 60% alcohol. Maintain at least 1 meter physical distance. Avoid going to crowded places. Avoid touching your face, that is eyes, nose, and mouth. Practice good respiratory hygiene, that is covering your mouth and nose with your bent elbow or tissue when you cough. Please don't cough into your hands, don't sneeze into your hands, and don't touch your face, nose, and mouth. When you need to cough, use your bent elbow to do it, or also cough into a tissue and dispose it appropriately. Stay home and self-isolate when with minor symptoms such as cough, headache, mild fever, because you never know. So you might be having COVID-19 or not, but until you recover, please self-isolate and stay at home. Then we have the COVID-19 vaccination that is currently available in the country. So moving forward, we are still saying avoid close contacts with anyone who has had cold flu or flu-like symptoms. Always clean and disinfect regularly touched surfaces, and always wear a face mask while in public places, including when you are in schools. All teachers, even non-teaching staffs, even the learners, make sure that you always wear a face mask while in public places. Avoid shaking hands or hugging people, avoid social gatherings, and if you have fever, cough, and difficulty in breathing, please seek medical attention. So some of these containment measures that we are talking about, we are going to stress on them so that we understand why we are doing them. Number one, we are going to talk about face masks, okay? When face masks are correctly worn in public, it helps prevent the spread of virus from one person to another. We previously saw that the virus is spread through respiratory droplets from one person to another. If you are in a close proximity to that person or you are in a public place, and this person either sneezes, talks, the droplets come out and you can breathe the droplets and you can get infected. So when you are in public, to stop the spread of the virus, please put on face mask. We have the surgical mask, the N95 mask, cloth, okay? We are still stressing that wear the masks at when in school and in public places. Do not share masks at any time. And this one we are saying especially so that you stress it to the learners. They should never share masks. A person put on their own masks. A face mask covers your nose, mouth, and chin. Do not just have a mask on your face covering only your chin, provided it is a mask on your face. No, put it on properly, and it should cover your nose, your mouth, as well as your chin. Do not use face masks as a substitute for social distancing and washing and sanitizing. We are using all these methods together. These are some of the examples of cloth masks that we can use. And as teachers and the school administrators, we can even invent ways to make sure that the learners have clean masks every day by inventing different colors for each day of the week so that we ensure that even after putting them on, they go home and have the masks washed. The cloth masks are washable and can be reused, but let us not use dirty masks. They have to be clean and dry. When the masks are washed, let them dry in open sunlight so that we can put them on. So the cloth masks are cheap, simple to make, can be washed and reused, made from common materials, should be adequate in size, because we know even the learners, some have small faces, so we should make them that fit them correctly so that it covers the nose, the mouth, also the chin, and also should have multiple layers of fabric just to enhance the protection. and it should be washed daily and left to dry in direct sunlight. We are stressing that do not wear a dirty mask. Let us even tell the learners in our institutions that they should be washing the masks and having clean masks every day. So the surgical masks, these are disposable. You use them once and dispose. The N95 masks also are disposable. After use, you dispose. We have the face shields as shown in the picture. If available, you can also use them, okay? Wearing a face mask correctly, we can see from these pictures how the face mask is supposed to be, okay? We have stressed on that so that even in schools, we reinforce that we need to wear the face mask correctly. Disposal of this face mask, okay? Dispose used masks in a specific closed bins. So this is a closed bin where garbage collection facilities may not be available. Burn the used masks in a safe place or bury in a garbage pit. If you find a mask lying around, even if it is a reusable mask, that is the cloth mask, please treat it as infectious and dispose of it in a bin or burn it, okay? Stress this to the learners, especially to the young ones, because a person might pick a mask and they are very excited because maybe they did not have a mask in the first place. So discourage that as much as possible. Let them know that a mask that is not yours, treat it as infectious and it should be disposed of in a bin or it should be burned, okay? So some precautions that we need to take: children younger than 2 years old should not wear masks, or anyone who has trouble breathing, or anyone who is unconscious, incapacitated, or otherwise unable to remove the masks without assistance, okay? So the special considerations for masks in school: we have people who are deaf or have difficulty in hearing, and these people may need lip reading as a form of communication. So we need to weigh the risk of infections against the benefit and invent ways to communicate to these people, even ensuring appropriate distance within these two people so that to prevent cross infections, okay? People with intellectual and developmental disabilities, mental health conditions, or other sensory sensitivities also may have challenges wearing a mask. We have also said younger children, especially in preschool, may be unable to wear a mask properly, and particularly for an extended period of time. So as teachers, we need to work with them constantly, guiding them and monitoring them all the times to ensure that they have their masks on. Those with swimming pools, okay, let the learners not use masks in the swimming pool and let them not have wet masks on, even on. The mask should be dry when they have them on, okay? We are moving forward. We are now going to look at hand washing. And hand washing has been with us even in school. We have water, sanitation, and hygiene sessions where we practice hand washing. Even outside the COVID-19 pandemic, we have been practicing hand washing, but now we are talking about effective hand washing, and there are steps that we can follow to ensure that we wash our hands effectively. So step one, wet your hands with clean water, then apply enough soap to cover your wet hands. Then you will scrub all the hands, the surfaces of the hands, including the back, between the fingers, and even the nails. This for at least 20 seconds, okay? Then rinse thoroughly with clean water, then you dry the hands. We will watch this short clip on steps of effective hand washing. Okay, we have seen the steps of hand washing. Kindly wash our hands, tap, even, but it is running water in. So when to wash hands, we have regular times when we need to wash our hands with clean water and soap before eating, after sneezing or coughing or nose, after using, after touching or cleaning surfaces that may be contaminated, after using instruments like computer boards or even knife, or immediately coming from outside, especially the learners when they're coming out from outside, when to make sure they wash their hands regularly. In the absence of clean running water, soap, we'll use hand sanitizer. So if some water are not available, use sanitizer containing at least 60% alcohol. Apply adequate amounts of hand sanitizer, palms of one hand. We'll rub together, covering all the surfaces of the hand, even between the fingers, the thumb, and even the wrist. Rub your hands together until the waterless hand sanitizer is completely dry. Please do not rinse or wipe off the hand sanitizer because it may not work as well against the germs. Rub your hands until they dry. So these are the steps for effective hand sanitizing, and we are going to watch this short clip also on effective hand sanitizing.
Hand sanitizer is a convenient alternative to hand washing if there's no soap and water available, and as long as your hands aren't visibly dirty. Apply sanitizer, rub your hands palm to palm, and wash the backs of both hands and in between your fingers. Then palm to palm with fingers interlocked. Clasp your hands together and rub, and then clean around the thumbs too. Rub your fingertips in the palms of your hands, and finish off with the wrist.
Thank you so much. We have seen effective hand sanitizing and the steps that we need to take when hand sanitizing. Precautions with hand sanitizers. Please do not apply hand sanitizers to the lips, eyes, nose. Please drink the hand sanitizers. If hand sanitizer is accidentally rubbed in the eye, kindly wash the eye with plenty of water. Alcohol-based sanitizers have over 60% alcohol, so they are flammable. Kindly keep away from fire. Next, we are talking about social distancing, and here we are saying maintain at least 1 meter physical distancing. We have seen this even from the beginning, talking about let us ensure that we maintain at least 1 meter social distancing. Lastly, we are talking about COVID-19 disease, vaccine, sorry. We are saying COVID-19 disease has no known treatment. So prevention is very key. That is why we have talked of the above containment measures. On top of those containment measures, we now have the vaccine that is available to eligible population as we have been advised. So COVID-19 vaccination will help prevent you from getting COVID-19 disease. And the vaccine that is currently available have been shown to be highly effective at preventing the disease. And it protects us from getting severe COVID-19 disease. So getting vaccinated protect people around you. As much as you protect yourself, even people around you get protected, particularly those people who are at an increased risk of severe illness from the disease. We are saying that the vaccination is a safer way to help build protection And it offers a natural protection known as immunity. When you get vaccinated, your body develops this immunity that protects your body. And it also protects you by creating an immune system response. And this happens without you having to experience sickness. So we are saying getting the vaccine will not make you sick. It will create antibody immune system response in your body, and this can only result to some mild side effects that can be managed, but you will not get sick from getting a COVID-19 vaccine. The vaccine works with your immune system so that it is ready to fight the virus if you are exposed. So we are saying stopping the pandemic requires us to use all the tools that are available for us. And COVID-19 vaccine, an additional tool that we now have on top of the ones, the containment measures that we have discussed, we have this additional tool that will help in stopping the effects of the pandemic. So currently, the target population for vaccination, we have the frontline workers, and the frontline workers are all healthcare workers in the facilities. And we are seeing also those who are providing critical services, the teaching and non-teaching staffs in all educational institutions are also earmarked for vaccinations, as well as uniformed forces. Then we have individuals over 50 years and also individuals with comorbidities. Those are people over 18 years who are living with other conditions, maybe cancer, diabetes, other cardiovascular diseases. So if you are eligible for vaccination, kindly take it so that it enhances your protection. Being a new vaccine, we have so many questions that maybe we are still not sure of. Internet. Hi, am I back? Okay, thank you. Sorry for that. We are saying some of maybe the frequently asked questions about this vaccine. We are saying the side effects, maybe you might feel soreness, and a smaller proportion may develop fever or chills for a day or two. But use of paracetamol or any other pain medication may ease the symptoms and the person will just feel well. So can a person get COVID-19 from the vaccine? We are saying no. Said no. What if I have an underlying condition such as diabetes or HIV? We are saying the vaccine is safe, and the vaccine is even much more important because of your high risk of having severe COVID-19 disease without prevention. So it is safe. You can have the vaccine. Does the vaccine work for elderly people? Yes, it has been proved. That is why even among the eligible group, we are vaccinating elder people. So in summary, I want to say that the containment measures that we have talked about, let us take them seriously. Let us wear the masks while in public places and in our schools, and kindly wear the masks correctly the way we have shown you. Avoid social gathering and keep both physical and social distancing appropriately. Wash hands frequently, and we have talked about effective hand washing. In the absence of clean running water and soap, you can use hand sanitizers. And lastly, vaccine is the last tool that we currently have as a country. And those who are eligible, kindly take the vaccines. That is the end of my presentation. We will continue with the other presentations. And over to Madam Salome. Thank you so much for listening and for participating.
Thank you, Madam Beatrice, for the comprehensive presentation. Schools administrators and teachers, please put your comments on the chat box, your questions that you may have, your issues, your observations. Please continue putting them in the chat box. We will respond to them. Allow me to invite the second presenter, Madam Salome Gashina from Ministry of Education, to take us through schools' response to COVID-19. Madam Gashina, over to you.
So good morning, everyone. My name is Salome Gashina from the Ministry of Education, and I'm going to take you through this second presentation on the school response to COVID-19. After being given a lot of information on COVID-19 as a school, and we are going to look at how do we respond. You know, we have done this, but we are saying that we really need to emphasize on upgrading or ensuring that the way we respond to COVID-19, it is really done in the right way to prevent the spread of the virus. There are many questions about the vaccine, but we shall answer after this session. So we shall start by having a small activity, and we want you to just put your answers, your responses in the chat on how do you or how have you ensured that the school remains safe for everyone? How do you ensure that the school remains safe for everyone? Just type your responses on the chat. We shall go through them together. Making sure there are no visitors, taking temperature at all times, cleaning up and hand washing sessions, keeping social distance, fumigating the classrooms, providing water points, social distancing, wearing masks, taking temperature at all times, coming up with sanitization points, hand washing, following the set guidelines and protocols, ensuring there's enough clean running water, following the guidelines, wearing masks, proper wearing of masks, vaccination, thank you, all learners to wear the mask, creating awareness, providing hand wash. Keep posting as we continue. Thank you for your responses. So it is important, plus what we have put on hand washing and what we've been taken through by Madam Beatrice, one of the very important thing is the water, sanitation and hygiene facilities. It is important that we ensure our schools have sufficient clean water that is available at all times for drinking, for hand washing, in preparation, and for cleaning and laundry. If inconsistent or inadequate, if there is inconsistent or inadequate water supply, then it is a concern for the school to ensure that we increase the water storage capacity. We know this challenge is there, but we are saying we need to see how best we ensure that there is enough water to drink, to hand wash, for food preparation, cleaning, and laundry. The other response is on the supplies Each school should have adequate supplies to support these healthy hygiene behaviors. And this is to include adequate soap, adequate hand sanitizers, enough detergents, ensuring there is enough tissue paper, and also ensuring there are waste bins that have covers at strategic points in the institution. Other supplies would include things like sponge, the brooms, the floor brushes, the buckets, the floor clothes, toilet brushes, among others. So the laundry equipment again. We should also ensure that in our supplies, we have adequate protective equipment, such as the face masks, the overalls, the boots, and the gloves. So that is in terms of supplies. We need to ensure that that is adequate. So for ensuring that these protocols are observed, it is required that every school constitutes a school COVID-19 response team with a COVID-19 focal point within the institution. It should comprise the staff, the non-teaching staff, and also the learners. This is to ensure that issues and the practices, the protocols on COVID-19, there's a team that is actually responding or coordinating in the school. It's also important that we sensitize teachers and other staff on COVID-19. What we are doing right now, it's our expectation that this information will go. Since frequent sensitization, and like Joyce said, this can be done even on assemblies when the teacher is in the class. It's important that this sensitization is done to all the teacher staff and also the learners. Train on how to recognize the symptoms of COVID-19 early, like Madam Beatrice has taken us through. This information also should go to the learners, the teachers, and the staff. COVID-19 instruction, education, communication materials should also be displayed in strategic places in the learning institution. You know, we remember more what we see than we do, and we say for children, it's monkey see, even for adults, it's monkey see, monkey do. So when we have these materials displayed all over, it's going to really help us a lot in behavior change. The learners, the teachers, and other staff with respiratory tract illnesses, for example, someone is having a running nose, the cough, or the fever, regardless of their COVID-19 infection status, should be allowed to be away from home and instead be given permission to seek health care in a healthy facility. So when teachers have these respiratory tract illnesses, it is important we allow them, even the learners and the also non-teaching staff, regardless of their COVID-19 status, allow them to seek medical attention. Afterwards, they should stay at home until the respiratory symptoms are clear. So they should not come back when they are not feeling well. Just allow them to be home until all the symptoms have gone. On continuation on the response, most of us said this in the chat, that we need to reduce visitors in the school. We should not encourage many visitors in the school. We should also ensure that we clean and disinfect the classrooms at the end of the day on daily basis. These classrooms, the laboratory, and other rooms that we have in the school, they should be cleaned and disinfected. Thorough fumigation should be done, especially where we have had a COVID-19 case. Fumigation is very, very important to fumigate those areas, although the area, where we have this COVID-19 case, we need to do thorough fumigation, which I'll see how. Then we also need to have the holding or the isolation rooms for those who may have fever or other symptoms suggestive of COVID-19. So the isolation rooms, I was in a school and the teacher told me, no, we don't have one because there would be stigma and trauma, but we are saying it is important to have this room, would rather be safe. It's for safety reasons. And again, when we do a lot of sensitization, then we'll not be having the stigma. So it's good to have the room for isolation, just in case we have suggestive of COVID-19. It's also important that we have emergency contact. We are saying this is a challenge for us in the learning institution, but we cannot fight it alone. So it's good to coordinate with their other stakeholders or other people like we already have the sub-county and the county COVID-19 response team. We have the Ministry of Health. It's good to have this emergency contact. When this happens, then what do we need to do? Linkages to our health facilities and ambulance services is also very, very important so that in case there is an issue, we get support immediately. Again, we are saying with COVID-19, it brings a lot of psychological, emotional strain or disturbance. So psychosocial and mental health wellness support is very, very, very important. Remember, COVID-19 comes with a lot of stigma and discrimination. There's a lot of anxiety and confusion. We're encouraging schools that we have psychosocial and mental health wellness support. And this we can do it with the guidance, the existing guidance and counseling facilities that are also there, and also sensitization on issues of how do we offer psychosocial, and we shall do that in the afternoon. Still on the school response, we are saying it's important to have temperature screening at the entrance of the compound where we have one entrance, but we can also have it at designated places. So temperature screening is important, and this should be done on a daily basis for all learners, teachers, and non-teaching staff, and any visitor who comes to the school. Hand washing stations, they should be designated at strategic points in the school compound. So hand sanitization facilities also at strategic places. For schools, we are really discouraging the use of the sanitizer, but again for learners, because they may misuse them. But for the adults, the visitors who come, the hand sanitization facilities should be all over in strategic places. Maintain a 1 meter physical distance between learners in classes, in the dining rooms, in the laboratories, in the dormitories, sanitation facilities, in school transport. We know this is a challenge, but we are saying where we can, it is important we ensure that we maintain this 1 meter physical distance. Wearing of masks by all learners, teachers, and other staff. Beatrice has really emphasized on that. So it is important that we also do that. We ensure that we wear masks. And teachers are very, very important because we are the models in those learning institutions. So when we model the wearing of masks, the learners will quickly pick, unlike where we have teachers who don't even believe there is corona. So it's important that we enforce the wearing of masks by everybody in the school. All the visitors to the school should always wear a face mask. And this is important to enforce. So on temperature screening, we are saying that we need to use a functional thermogun. That thermogun should be functional. The school community and authorized visitors who are visiting the institution must have their temperatures taken and recorded. This record will include their full name, their telephone number, and places of residence. Confidentiality should be maintained. These are personal records for this visitor. However, if the institution may share this information with authorized interested party for the purposes of contact tracing if need arises. So maybe we had visitors and we have a case of COVID-19 positive, then this information can be shared, but it can be shared with the interested parties for contact tracing. Any person with temperature reading above 37.5 degrees should be isolated. We should inform the county rapid response team and the parents, the guardian for further action. We also have the sub-county rapid response team. We are near the sub-county. We also have that, the county, the sub-county, and we also have the regional rapid response team, and we also have the national. So depending on where you are, it is important that when we have these cases, let us inform them so that we get the necessary support. On the isolation room, we are saying again, we need to have an isolation room in the learning institution. The room should have hygiene supplies available, where we need to have enough face masks, the face shields, the tissue papers. We also need to have enough water and soap for hand washing or a hand sanitizer in that room. Where possible, we could have a bed for if one needs to lie down as they wait. That room should also be well ventilated, and it's important to ensure we open all the windows to allow air circulation. There should also be a closed bin for waste management. If weather permits, this isolation area can also be outdoors in a tent. This is to allow free circulation of air. So we are encouraging, let's have these rooms because they're going to really help us in case we have a case, and therefore it will be very, very key. So I want us to look at a case study here. It could have happened to us, and in case it happens to us, what would we do? And I would want us to type our responses in the chat. So we're asking, how would you handle the following situation? You have just found out that there's a sick staff member or a learner with symptoms consistent with COVID-19. So they have a new onset or worsening cough, or they're having shortness of breath, or they have at least two of the following symptoms. For example, the fever is taken and it's above 37.5. They're having chills, they have muscle aches, having a headache, they have a sore throat, and they also have lost their taste of smell. So how would you handle a minute to type your responses in your chat? And if it has happened in your school, how did you go about it? So I'll give you about just 1 minute. You type those responses on the chat, and we shall go through them together. Isolate immediately, take them to hospital, link them with the healthcare, contact somebody, call immediately, isolate, give paracetamol, isolate and inform the medical team, isolate the individual, call for the response team, contact the nearest health facility, call the health facility, isolate immediately. These are correct answers. Report to the COVID-19 team, isolate and take the necessary measures. Good. Get in touch with the emergency response team. Act, be calm and reassure the person as you isolate them. Good. Isolate and call the response team. Call the guardian or the next of kin. Isolate and call COVID-19 immediately, response team immediately. Isolate them and link them to the health department. These are good answers. Let them keep calming. Let's look at what I have. Those are good responses. Thank you. So we have two cases on scenario 1. It's important to inform the school rapid response focal point. Yeah, the institutions, we are saying we need to have this COVID-19 response team and the focal point, so to say. So they need to be informed, just like what you have said in the chat. Isolate the person. It's very, very important in the isolation room. Inform the sub-county or the county COVID-19 response team. Then after that, you test for COVID-19. The staff who are monitoring the learner or the staff member with the symptoms should also wear the protective gear and practice social distancing. So it is important when all these symptoms are there, people need to observe the protocols. And if it's important to manage for other illnesses and resume classes when either the staff or the learner is well. So in case the test is done and they are negative, manage those other symptoms, the running nose, the cough, all the symptoms that could be there. And when they are well, they should resume class or work. But again, like we had said earlier, it is important that they don't resume when they are not okay. So that is scenario 1 when the cases are negative. So in scenario 2, you may have tested that person, that child, that adult, or that other staff, and they were positive. If they test positive, what do we need to do? We need to isolate for 14 days, and this can be done at home. the school sanatorium, or a health facility. Some of us said, and it is important, like we had also said, and I saw it in the chat, that we need to either tell the parent or the guardian. So it can be at home, the school, and the health facility, depending again on our different situations. Even with that, we need to reinforce hand washing, masking, and social distances while in isolation. I'd seen one of us had asked whether when we test positive and we're in quarantine, when we are in isolation or when we even had the vaccine, whether we should continue. So these practices should continue even in isolation. The hand washing, having their masks on, and social distancing. We also need to monitor the symptoms. How are the symptoms going? And we also need to provide the supportive care. One of the responses said that we don't need to panic. Because again, when we panic, we are not able to do the right thing. So this supportive care, the assurance, the not panicking is also very, very important. Because as we are aware, COVID-19 comes with a lot of anxiety. Some people have the perception it's a deadly disease and I will die. Yet that is not true. So that psychosocial, that support is very, very important. That's reassuring that person is going to be okay. Then it's important that we also do contact tracing and quarantine contact. And when we do the contact tracing, we shall look at who are these people. Then they should also go for isolation for 14 days, again, either at home, in school, or in the school sanatorium, or the quarantine, or a health facility. So it could be in a class or a dorm, and this has happened. So the learners or the teachers around here, again, they should also go for isolation. Then they should test for COVID-19. If they are negative, they resume work. In case this happened in a class, this particular learner or the teacher was in a classroom or in a room in the school, then it's important to close that room for 24 hours, clean and disinfect or fumigate. Very, very important, just to ensure that the virus does not spread to others. The sub-county COVID-19 rapid response team should come to assess the transmission level. So it is important they are informed and they come to the school so that they also assess the transmission level, then they will advise accordingly. Then we resume school or work after this criteria is followed. They're positive, they have gone home for 14 days, and they can resume school or work if there is no fever for 24 hours without medication. If there are no symptoms for 10 days after the symptoms appeared, and they also need to retest to show when they retest and have their results negative. So with those conditions, the learner, this teacher or the staff can resume work, for the learner can come back to school. So no fever for 24 hours without medication, no symptoms for 10 days after symptoms appeared, and a retest that shows that that person is negative. Then how do we handle a learner or a staff with symptoms of COVID-19 in the school? We're just adding on to what we have just discussed. The sick person should wear a face mask. It's important that they have the mask on. Anyone who enters the isolation room must use the appropriate personal protective equipment. So arrangements should be made for the unwell learner or staff to be quickly evacuated from the school. This is where we have the symptoms. While they wait for the medical advice or transfer to the health facility, they should avoid any contact with others. This will ensure that transmission does not continue. So it is important that when we have these symptoms again, these protocols should be observed. Continuation, they should be advised to sneeze into the crock or their elbow, or cover their mouth and nose with a disposable tissue when they cough or sneeze, and dispose it into a bin that has a lid. So the waste management, we shall look at it. Those bins should also always have a lid. So they should be encouraged to sneeze into their crock or their elbow. If they need to go to the bathroom when they're waiting for the medical assistance, they should use a separate bathroom where available. In case we don't have a separate one, they can use what is there, and then it is fumigated after they have used it. One should wash their hands thoroughly for 20 seconds with soap and water after any contact with someone who is unwell with the symptoms consistent with coronavirus infection. Beatrice took us through the process of hand washing, so this needs to be done again when we have come into contact with somebody who have the symptoms consistent with the coronavirus infection. So how do we clean or disinfect this isolation room? So we have our learner or our staff, and they have gone to hospital, or they have left. They have used the room for some time, and then we want to clean it. How do we clean it? So you should close off the space used for isolation after the sick person leaves. Yeah, close off the space used for isolation after the sick person leaves, and then wait for 24 hours before you clean or disinfect the space. And if 24 hours is not feasible, wait as long as possible. Don't just use the room immediately. Wait as long as possible. Open the outside doors and windows and use ventilation fans where they are available. And this is to increase the air circulation in that room. All the surfaces that the suspected person has come into contact with must be cleaned, including all surfaces and objects visibly contaminated with the body fluids or respiratory secretion. This could have happened in the lab or in the home science room or in the class or in the dining room. They need to be cleaned thoroughly. And all potentially contaminated high contact areas, such as the toilet, the door handles, the desks, individuals, either in the lab or in the class, should also be washed. It's important to wear gloves, cleaning and wash hands after. So we should not assume I have removed the gloves, it's good to go and do the hand wash appropriately. Open the space for use after proper cleaning. Infecting, been touched, or they could have had this contact, so they need to be washed to avoid the transmission. So how do we do contact tracing? And according to World Health Organization, they define a contact of COVID-19 case as any person who was in face-to-face or physically into contact with a confirmed case. So this learner who had all the symptoms, and after they were taken to a medical facility, they are positive. So that's a contact. Any person who was within 1 meter with the confirmed case for about 15 minutes. So somebody who was around there, it could have been in a class, in a dorm, in the dining, in the dormitory. So they should also, for about 15 minutes, yes. It's also they're also a contact case. Anyone who has cleaned up any body fluids without adequate PPE, they didn't have gloves, they didn't have overalls, they also didn't have any protective clothing, then that's also a contact. It could be there's somebody who was taking care of this learner when they had all the symptoms and they had not tested. And anyone living in the same household as a confirmed case. This is a child who comes to school and their parents, after a few days, they're positive. So all these are contacts. So also other members of the school community who have not had, however, other members of the school community who have not had close contact with the original confirmed COVID-19 case should continue taking the usual precautions and attend work and school as usual unless they become unwell. Sometimes when we have COVID-19 cases, people panic. So we are saying for people who have not had any close contact, they need to continue with their usual work unless they become unwell. So when they become unwell, then the necessary medical attention needs to be taken. So we are saying this information is important so that we don't panic and we close the class or there's a lot of anxiety within the school. So we realize with the precautions for COVID-19, there's certain precautions that need to be taken care of, like waste management. We may be having a lot of waste now, the issues of food handling and the school transport. So I would want us to type in the response chat some of the safety precautions we could put into place in the school transport. What are some of the precautions that we need to put in place, or we have been putting in place in the school transport? Then I'll give you about just 1 minute. So let's keep the responses coming. Then we shall continue. Increase the number of trips, increase the mode of transportation, fumigation, ensuring social distancing, read masks and sanitizers, sanitizing a must, limit the number of children in any trip, staggering transportation so that we don't have them all the time together. Thank you. Thank you for that. So we shall look at how do we go about it. Keep typing the answers. So on school transport, we are saying it's important to screen, like many of us have put in the chat, it's important to screen for COVID-19 symptoms every day. By checking the temperature before boarding the bus or the van. The student occupancy should be limited to 1 child per seat. Students should sit in a zigzag pattern to maximize distancing. One of us have said that in the chat. All the learners and the bus drivers should wear a mask at all times while in the bus or when they are queuing to board the bus. So the learners and the drivers should wear a mask. We should not have a situation where the driver does not have a mask. Encourage or enforce that they wear the mask at all times. Whenever possible, the windows should be kept open to enhance air circulation. It's important also to wash hands and sanitize before boarding the school bus. So we have a responsibility to share this information with the parents so that they know, especially when kids are being picked from home. As we continue, still high-touch areas, for example, the rails, the seats, and the seat belts should be cleaned and disinfected before each trip from home to school and back. So it's important that these high-touch areas are cleaned and disinfected after every trip. The school should designate school buses to allow for contact tracing in case a learner exhibits some symptoms, where each bus carries this many children, these specific children, so that they are not staggered and we don't know who was in which bus. Each bus or van should have prominently displayed posters on COVID-19, including cough and sneeze etiquette. Again, remember you said monkey see, monkey do it to remind the children. The school buses should also have disposable tissues for learners who may cough or sneeze. And these bins should be available for disposal of the waste while in the bus. So you can have a foot-pedaled one where they don't have to touch the bin. And it should also, like we said, the bin should be covered. The vehicles should be cleaned and disinfected on daily basis. It's important to maintain physical distancing when boarding or alighting from the bus. Sometimes kids are excited to go home, they crowd. It's important to remind them that they need to maintain the social distancing. What about for the food handlers? In schools, we have food. We have the kitchen. We have people in the kitchen who are preparing for us food. So what should happen to them? They should have the requisite food handling certificates, and they can get this from the public health facility. So it is important. We should not encourage those who don't have these food handling certificates. All the food handlers should also have a symptomatic screen for COVID-19 on daily basis. In case there are those with symptoms of COVID-19, like fever, the cough, the shortness of breath, breathing difficulties, or fatigue, they should be allowed to seek medical attention. So we should not have them in the school preparing food for us. They should also observe strict respiratory hygiene, like covering their mouth and nose when they are coughing or sneezing. They should also dispose the tissues. They should also have adequate hand wash for them. So basically we are saying they need to observe strict respiratory hygiene. They should also observe personal hygiene measures. It's also very, very, very important. And they should also ensure that they wear their face masks at all times. They have their caps and their headscarves on. They also have the disposable gloves and the cleaning overalls, among other items that they need to wear, the gumboots, and the gumboots, and those personal hygiene measures, they should always observe them. Again, they should ensure that they maintain physical distances at all times. So when they're working surface in the kitchen, they should maintain this physical distancing. The number of the food preparation area at any one time should be limited to reduce physical interactions. So again, this is to avoid the physical interaction. They should ensure that we have limited staff. Food handlers should also promote frequent and effective hand washing, like Beatrice took us through, washing the hands with soap and running for 20 seconds at each stage of food handling. The workstations should be spaced out, and the food workers should avoid facing one another. So the way we arrange the worktops, for example, in the kitchen, they should not face each other, but instead they should be spaced out. The food handlers with respiratory tract illnesses, for example, someone has a running nose, the cough, or the fever, should avoid coming to school, but instead seek care in a healthy facility. So they need to be sensitized on this so that we give them support, and we also prevention, so that when they are ill, they don't have to come to hospital. Instead, they need to seek care in a healthy facility. Open windows to allow aeration at all time where possible. It could be in the kitchen. They need to, where they are working, it's important that the windows are also all the time open to allow aeration at all times, and we are saying where possible. We realize again we have a lot of waste, and waste management is also very, very important as part of the protocols. And we are saying then for waste management, we have many masks, especially we are using the surgical masks. So generally waste management needs to be taken care of. And we are saying, what do we need to do? We need to have covered bins available for disposal of waste at strategic points in the school. So depending on our settings, it's important that we have adequate covered bins to dispose waste in strategic points in the school. The collected waste should be disposed of safely on site, maybe where we are having an incinerator, or we could be having an adequate landfill, or it can also be transported to a waste or a dump site. So this disposal should be safely done. We could also, burning of infectious waste can be done in the absence of the incinerator. We are saying even where we don't have incinerators, we can still burn this infectious waste, but should be done with strict observation of safety measures. So safety measure, observing strict measure when we are burning this is very, very important. Each school should assign a person responsible for waste management, and involving the learners with sensitization and the staff and even the members of the non-teaching staff would really help a lot. And basically, again, sensitizing all the learners on how to dispose waste would be very, very, very important. The routine sensitization on proper disposal of waste to the school, to the children, that is the learners, to the teachers and staff, is also very, very important. And this needs to be done many times. People forget, So it should be a routine sensitization. Like Joyce said at the assembly, when we're in the class, we're in the lab, in the dorm, that routine sensitization will really promote behavior change. Proper protocol collection and disposal of waste is also important. How do we collect, or how do we even transport this waste to the land, the adequate landfill? So that proper protocol of collection and disposal of waste is important. Also having instructional education communication materials on waste management displayed in the school. That is very important. It will help our learners see and therefore remember, and therefore also do the right thing. So in our learning institutions also, we have some special considerations and guidance for groups who are at risk. So like my colleague has said, the COVID-19, and we are all aware, and we are aware also we are front line workers. COVID-19 vaccine is available, and everybody who is eligible is encouraged to get the vaccine. Teachers, we are one of the eligible groups, so let us get this vaccine. Teachers and other staff above the age of 58 years, those with comorbidities could work from home or do the administrative duties where they don't have to really interact with many people. For children with high-risk medical conditions, they may be considered for homeschooling or online learning where possible. And this one, we need to really work with the parents so that they give us this information of their children who could be having some high-risk medical conditions so that we can be able as teachers to handle them correctly. So finally, we have a last question here, and we are asking, as a way of summarizing our session, what equipment is required for protection against COVID-19? I will give you a minute to type your response in the chat box. What equipment is required for the protection against COVID-19? So put your answers in the chat. Face mask, marked seats, that's very good. Sanitizers, face shields, the gloves, the PPEs, the sanitizers, thank you. The thermogun, very good. The face shields again, the covered dustbins, yes. The PPEs again, the thermoguns again. Thank you very much. Adequate water. Dustbins that have lids, vaccination, Daniel, masks and hand sanitizers, there's enough soap. Thank you very much. Keep them coming. Keep typing, washing hands. Thank you very much. Keep typing. So we are saying, as we summarize this response, is that this equipment, like you have put in the chat and like we have discussed since morning, we need the functional thermometers. Those are thermoguns that are functional at all the screening points. So it's for the schools to designate these screening points and also give a responsibility to people who need to do that on daily basis. We also need to have the PPEs, that's personal protective equipment, and this needs to include the overalls and protective aprons, protective headgears like safety helmets, safety boots or shoes, safety glasses or goggles, the face shields. We also need to have gloves, the surgical masks, and we are saying the PPEs are particularly important when we are handling the learner or a staff with symptoms of COVID-19. But again, we are emphasizing that they need to be there in our supplies because we need them. But again, we are saying again, collaboration with the other stakeholders, Ministry of Health is also very, very, and the responses team, the COVID-19 response teams is also very, very, very important. So as we are finishing, I would want to emphasize, I would want to conclude and say that it is important that we ensure that we respond positively to this. Many things that we have talked about, Sometimes people forget, learners will forget. So again, creating awareness is also very important so that the perception of the threat for COVID-19 is heightened. And therefore people, when we do that, when the perception of threat is high, then the positive behavior change is achieved. So this information, don't keep it to yourself, let people know so that we are able together to have positive, the new normal and adapt it, and it becomes part of us, and we don't have places where sometimes these responses are not taken seriously. So otherwise, I wish you well as we continue. Thank you very much. If you have any questions, just put them in the chat. We shall respond. And thank you so much. And back to Salome.
Thank you, Madam Gashina, for the good presentation. We need to take a break of like 15 minutes. Please put your queries and comments on the chat box. We will respond to them when we come back. So grab a glass of water, a cup of tea, your uji or something as you wait. Just 15 minutes and we'll be back. Please don't log out, just remain in. We'll be back in a short while. Thank you for staying with us.